Really? Oh, okay. All right. And I'm really excited about hearing myself echo. I'm really excited about this conversation. The municipal financial empowerment field, a new and emerging innovation that's hitting local governments across the country. I want to tell you a little bit about the origins of this subfield, and then launch into a discussion with my panelists. Was the head of a consumer protection agency in the city of New York under Mike Bloomberg. And like so many of you here, I had a day job. You know, I was running a regulatory agency. Our teams were doing the things, the different pieces that needed to be done within one agency, within an administration that had dozens of agencies. And so, like you all, I very much understand that innovation doesn't just show up as the new thing you do. In some ways, innovation shows up as the thing you do with your spare time when you're done with your real job, which nobody has spare time for. And so the origin story for this concept of municipal financial empowerment, for me, the way it arose, I think, is sort of instructive, both for this subfield, but also, I think, in general, for thinking about innovation in local government. So I'm running this consumer protection regulatory agency. We've got 400 people doing licensing and inspecting and communicating and undercover work and on and on and on. And the mayor does some blue ribbon anti-poverty panel. They pull together a bunch of really interesting ideas. I'm sure you've all seen this happen. And one of the least interesting ideas that came up was more financial literacy. And what was interesting about that is that as the mayor was doing follow-up after this report came out and saying, well, here are the 24 ideas, and who's going to take each of these ideas and see what we can do with them, they got to financial literacy, and the question was, well, all right, who in our government does financial literacy, and let's give them a call and make this their headache. And one of the realizations was, well, actually, government doesn't really do financial literacy. That's a nonprofit thing. And so then the question was, well, who are we going to give it to anyway? We got the call. And I think that one of the reasons we got the call at the Consumer Protection Agency was the people that we were talking about protecting were also the people who we were talking about empowering with this literacy. So we get the call, and we're asked to try to think about basically something innovative that can be done. Well, forgive me, there's nothing that can be done in an innovative way about financial literacy. And if you work for Mike Bloomberg and you turn around and you say, we've got a great new website and here's how many people visited it, or we did this class and here's the percent of people who after the class knew 3 more things than they knew when they started, or the percent of people who feel so much better about their futures, I would have been fired within a nanosecond. And so we really started to ask ourselves, I think, 2 fundamental questions. One is, how can you make an actual difference in people's lives around their financial well-being? And then even more transformatively, how can you do it in a way that uniquely brings in the value of government? Because not only are there resource issues around innovation, but there are political issues around innovation. If we were going to start talking about a topic that local government doesn't usually talk about, we couldn't pretend that we'd invented the topic. Nonprofit organizations had been working in that space for decades, and in New York, they'll hurt you, So needed to ask ourselves in a very deliberate way, well, what is uniquely value add to this equation? So we're gonna launch into that conversation in our panel. I just want to say that as this work began, we also had to say to ourselves, and I think this is important to innovation too, let's be very specific about what we're talking about, particularly in any city, but particularly in a huge city, you know, with 8-9 million people. We weren't suddenly innovating around anti-poverty. That's big. We were creating something that was a subfield in some ways of a subfield, and so we were very specific, and we gave it a name. We called it financial empowerment. We specifically identified 4 components that what financial empowerment was. It was access to education and counseling on finances. It was safe banking. It was savings, and it was consumer financial protection. And so we said to ourselves at the very beginning of this journey, we are specifically talking about those 4 topics and how they relate to each other and how you can advance those 4 topics. We're calling it something hopefully kind of catchy. And we are only going to do what we think local government can genuinely add to this equation. And that was the journey. Moving forward from there, we quickly created a national coalition where we invited in other mayors who were at a senior level doing more than just talking about this topic, but were actually trying to invest. As you all know, and as of course ELGL represents, the ability to get behind closed doors and talk frankly about the mechanics and the sausage making of government and of procurement and of politics, what the challenges are, what the opportunities are, what the tricks are. That was really invaluable, and I think helped move this field forward. So our panel this morning represents 2 important parts of the equation of, I think, any innovation in government, and that is somebody brilliant in government and somebody uber dedicated in philanthropy. Those kind of partnerships, I think, are key, and let's explore that topic. So you've heard our introductions, and if you all want to say more about your work and yourselves as you get started, go for it. But I want to start with the first question for the 2 of you, and that goes to the origins of this work wasn't in government before. And so the first question is, really, what is it about individual and family financial stability that has emerged as a government level issue rather than just residing within the nonprofit community? Amber, I'm going to start with you if that's okay.
Sure. Good morning. So when we began talking to our mayor about this work, he had been mayor for quite a while, cared very much about vulnerable populations, and had dedicated a lot of time and money and resources to sort of giving out fish, right? So we had a certain amount of the general fund that was set aside. It was 1.25% of our general fund was for direct service. Some of that direct service came from the city. Some of it was granted out to nonprofits to do the work. What we found was that people continually came back for those services. There was no teaching to fish. There was just fish. And so what was happening is the same people were coming for utility assistance. In fact, you know, our clientele is very savvy. They know exactly how much the cap is for the year, and we know when they'll start coming, right? We know when the day is that the utility assistance turns back on, and then they come, and we weren't lifting people out of that. They were just coming back year after year for the same amount of assistance. And so what we find is that that issue is prevalent kind of everywhere, but also that if individuals and families are struggling financially and never getting that leg up, it means neighborhoods are declining. It means the city as a whole is losing financial stability. And it becomes an economic development issue, right? So if you're trying to convince a company to come and set up shop in your city, you've got a problem if you've got a financially unstable residents, state of residence. And so the sell to our mayor that ended up being so successful was, this is economic development at the household level. And that messaging became, I mean, he just glommed right onto that, and it was what he said every time he talked about us. This is economic development at the household level, and it will raise all boats. And that messaging that doesn't just work; it's correct. So.
Yeah, and then just to add to that, so I'm Shakiria Brown. I'm with the Office of Nonprofit Engagement. I cover the U.S. Southeast for the firm, so that includes Florida, North Carolina, Tennessee, and the Carolinas, Tennessee, and Georgia. And so just to add to the point in terms of why we see this raising to the issue of government intervention. As a financial services firm, clearly we believe that financially healthy individuals and households are basically the foundation. If you're going to be building inclusive economically communities, you need to have financially healthy households. And so in doing that, we understand too that when you have that in place, you have more people that have the ability to either start or expand businesses. You have folks being able to buy homes, invest in education. And so it truly is the foundation in terms of which this, I think when you're talking about growing communities. In 2015, JP Morgan Chase actually launched the JPMC Institute. And so using the research and the data, basically the data that we have through the work that we do, we're able to deliver data and insights to communities, nonprofits through basically a cross-sector approach that gives insights in terms of how individuals and consumers are spending the resources. So those insights through that institute have highlighted, I think, what we already probably know in this room, but putting more real-time data to it and making it accessible to the community and to our partners in government and to our partners in the nonprofit sector. And so, one of the things that the Institute, one of the findings that came from the Institute highlighted something that I think that we've all heard is that most households don't have with the exception of higher income households, don't have the liquid assets to weather about 90% of financial fluctuations. And that's a significant thing. If you don't have access to any bit of emergency, you lose your job or you have a volatile income and an emergency happens, then you're already in a position that has a rippling effect to not only to your household but to the community that you're in, and multiply that by the amount of folks that are living in your community. I know, and then to just put that in numbers of what that financial emergency could look like, the Federal Reserve had issued, had actually conducted a study and it indicated that number was $400. So it just goes to show you the extent, and that's not a sustainable way to build your household or to build your community if we have individuals and households basically in that situation. I think the other, just kind of going into a little bit more, I think we recently just launched yesterday indicated our commitment to financial health. And you brought up the point about financial health, financial empowerment, and we also believe firmly that it goes a step further, that it's not about financial literacy in classes and supporting that, but it's also going deeper in terms of being able to support financial coaching. So basically just taking that data and that insight that's been offered, we just know that as local government, without making that investment, you will continue to see individuals turning to payday loans, to pawn shops, and to those other things that sometimes, unfortunately, are in our communities, in low to moderate income communities, and it just creates a spiraling effect. So just kind of wanted to start there with that overall.
Yeah, I mean, I think what you're hearing from up here is, is this two-part equation. There are a bunch of statistics that many of us have heard many times, and you've heard some today, about the state of financial instability. The truth is, I would say, financial instability is almost the American norm, as opposed to just kind of a low-income thing over there. The statistic that blew my socks off most recently is that 1 in 4 Americans are so much in trouble financially that they have a debt in collections. So A, this is the norm. And B, I think what you're also hearing from Amber is that from a local government perspective, that has ripple effects in local government. It affects political mandates, and this is where you can get some real pressure and opportunity. It also affects finances. You have more and more people that are coming back for resources that are scarcer. And more importantly, and I think this is a key to what Amber said, they're coming back again and again. One of the stats that really was formative for us as we started thinking about when we were going through the foreclosure crisis in New York was that you would mount these massive services to get people to avoid foreclosure. And then it turned out that 2/3 of them foreclosed anyway 3 months after you helped them redo their mortgage. So all of a sudden you realize, and it's so obvious when you say it out loud, that if people are in trouble with their mortgage, they're in trouble with their finances. And fixing their mortgage doesn't fix the rest of their finances. And from a government perspective, just to sound clinical for a second, you're going to just re-spend those resources again. And so what I would posit is that I think what you're hearing is that financial stability at the individual and family level is one of those underground currents that flows through all sorts of resources that you all are expending and struggling with and experiencing pain points on and political mandates to fix. Domestic violence, prisoner reentry, housing, workforce. If you aren't addressing the new American norm of financial instability of the people you are serving, you are A, going to probably have to serve them again, or B, it's going to take a lot longer to get them that help, or C, you're going to get more and more people coming. And so I think that part of what we have discovered, both from a government perspective and from a philanthropic, where do we make the right investment perspective, is you need to dig in to this issue that government didn't dig into before. The second important part of this equation, again, both from why would government do it and why would an investor invest in government, why would a philanthropic organization invest so much money in probably the richest entity in town, don't forget. The question is, what is unique government value add when it comes to this financial empowerment question? So I want to start with you again, which is what perspective philanthropically, what is it that government brings to the equation that you all weren't already funding for decades in different ways in your community partners?
So as you the nonprofits have been doing this work for decades, and obviously we value the work that the nonprofits do. We see partners. Is this going in and out, or is it? Okay. All right. Let's try that. Okay, it's kind of awkward, but we'll work, make it work. So yeah, so as I indicated, we had been, and we continue to obviously partner with nonprofits through philanthropy and our philanthropic investments. In terms of, I just think, summary in the beginning is the ability to scale. One of the things, and you'll see in some of the challenges that we've provided, obviously there are large nonprofits, smaller nonprofits, they're all doing work. I mean, we do think that, when you add local government into the equation, there's the ability to further scale solutions that are already working. The firm in itself is very much big on collaboration. We do believe that to really move the issue on the complex issues that we're addressing, such as the financial health of our community, you need to have not only nonprofits at the table, but you have to have business and you have to have government. And we believe that only when that happens, that's when you really start to you're able to start moving forward with solutions. So that's why we've been, investing. We were an early supporter of the Bank on Coalitions. We've invested in other efforts, and most recently, you've seen us launch programs such as Advancing Cities, which once again emphasizes, yes, nonprofits are leading the effort, but we want to see local government at the table for that very reason, because you get to, you bring folks to the table, you start to break down the silos, you start to look at things on a more systems level. It's one thing to address just the issue, but a lot of these issues that we're working with are systemic. And if you're not looking at it at a holistic place, the bigger picture, which is what government can bring to the table, it's not just about an agency, it's about serving this entire community or region. You need to have local government at the table. And our last, the most recent initiative that, we've kind of taken that approach is with the Advancing Cities, which was launched in 2018, the end of last year. It's a $500 million commitment, 5 years, to basically address the most pressing challenges that regions are facing. A part of that Advancing Cities challenge is to focus on there's a challenge, I should say, the Advancing Cities work, there's a challenge each year where we're looking to work with up to 30 cities. The inaugural challenge that just concluded earlier this year, and we announced the winners, actually resulted in 256 applications from 46 states and 143 communities. And at the end of that, we were able to pick the 5 inaugural winners. And what comes across in that is the collaboration with government and planning and being intentional in trying to cut down systems. So if you look at the winners, or I should say the cities that were selected, Syracuse, Miami, Louisville, Chicago, and San Diego, you're going to see local government agencies, or local government itself at the table working with nonprofits and businesses. So that's, where I see that is the ability to really amplify and scale programs that are already in place and bring new folks to the table. Here you go.
All right. Just yell if you can't hear me, okay? So in this why cities question, my number one answer to this always is exactly what Shakira said, is that nonprofits they're allowed to focus on a particular category of the population, which is wonderful because they can do some really focused work, right? So they can focus just on domestic violence victims, or they can focus just on homelessness, or, but what cities have is a mandate to serve everyone in the community. And so that's what makes cities, that's the unique value add that city government can bring to this work, I feel, is that we have to serve every single human being who lives in the community. And so what we can do in that role is we can be a connector, bringing all those nonprofits, to that table and being a gap filler, or we can be the service provider ourselves. But either way, we don't like to be the dictators that are saying you nonprofit must do this and you must do this. But what we like to do is work collaboratively with the community and say, what do you need from us? And what one thing that we have learned in this work, we've only been in this work for 6 years in our city. And what we've learned from this work is that when we improve the financial stability of our residents, it lightens the load on every nonprofit in the community, right? Because if everyone's lifting up a little bit, then the need is less pressing. The other thing that that cities, governments can provide is scale. So a lot of times we can be the ones who try out an innovation that a nonprofit may not necessarily be able to do, and then assist in bringing that to scale in the community. And then finally, one of the things that we did in the beginning, our first project in financial empowerment was to, first of all, open an Office of Financial Empowerment, which we did 6 years ago. And we did that because we got a grant from the CFE fund. And we wrote it into our proposal that it would create the office and a cabinet member, because then when we got it, we were like, oh, but we said we had to do this, right? So we kind of tricked our government into into this in a good way. Everyone is happy with that today. But what it allowed us to do is that grant from the CFE fund let us experiment with what was a sizable private grant. So no one was freaking out about general fund yet, right? And then we got to ease into this sort of public-private partnership where we were using some CFE money and some general fund money. My very first general fund ask was $60,000 for the year, and this year I have $500,000 for my office. Now we also now run a financial empowerment center, a children's savings account, a bank-on program, and a returning citizen program. So it's grown a lot and the staff has grown, but we were able to experiment with those private dollars and move into public as we proved ourselves instead of coming to the table like, we need $500,000 in general fund, to which they would have laughed us out of the room.
And I know we're going to talk about some of those programs in a moment. I just want to add a couple thoughts to this topic, which is, you heard a little bit earlier, you've heard two pressures. And I think that one of the things and I was in government for 12 years, I think that one of the incredible things that government brings to this mix is mandates. There are really powerful pressures that impact on a mayor and his or her team. One you heard about earlier, which was about finances. If in fact people are consuming and reconsuming resources and their financial instability is part of the mix, you have a math problem, and you have to solve that math problem. In New York City, for example, we're mandated by law to have a balanced budget. We had to figure these things out. Second, you heard about a mandate for scale. It's not just that cities kind of should serve everybody and that they have to serve everybody. And so what that means is in this space, as in others, when they're thinking about innovation, from the beginning, they're thinking about structuring innovation at scale. So that's pretty cool. The third pressure that government has is good old-fashioned politics. You have to get it right. And if you don't get it right, you'll read about it in the paper the next day. And so the beauty, I say that now that I'm no longer in government, the beauty of that political pressure is that you have to focus on quality. So if, for example, a mayor is going to get up and say, we've got a financial counseling program, we've got a banking access program, programs that we'll talk about in a moment, they have to get it right. They have to be delivering it consistently across different places within the various communities. They have to be able to make sure that there's data to show whether or not the investments are returning. And you have to be able to show that you're solving problems for real. You can't just have well-meaning volunteers or people who are kind of doing it on the side. If you're announcing a new service, you have to get it right. And so what I would say is that those economic pressures, those kind of core mandate pressures for serving at scale, the political pressures about quality and solving problems, those are, and I'm sure you all know this at some level and maybe explicitly, those are the rails that we ride on when it comes to innovation. That's what allows us to step in and do more than just say, hey, we've got another great idea, do you have some spare time? But instead be able to say, we might have some solutions here to some of those other problems. So let's get specific. Let's talk about a few examples of where these concepts of government value add are starting to show themselves across the country. Amber mentioned that she'd had a grant from this, the group that I run, along with Katie, who's in the room, the Cities for Financial Empowerment Fund. We started this movement where there were 6 cities, and we literally gathered around the dining room table at Gracie Mansion, the mayor's residence, about 10 years ago. And we're now working in 75 cities across the country with grants and technical assistance. There's a lot happening, and a lot happening quickly. Lansing, Michigan, thanks in large part to some terrific leadership, and particularly Amber, has really been knocking it out of the park. So I want to start with Amber, and you can tell us a little bit about some examples that you're seeing in Lansing, but also in some of your partner cities in the coalition. Amber was also the coalition co-chair for a couple of years. Tell us what's working, literally.
I did not prepare for talking about another city. I might have to think about that one as I'm talking.
Go plug other cities.
Yeah. So one of the most interesting for us is the Financial Empowerment Center is free one-on-one financial counseling, extraordinarily data rich. And so that was our first program, and we launched that in March of 2013. And when we wrote the proposal to CFE Fund, we said we were going to focus on 4 target populations, and one of them was returning citizens. The way that we got to that list of 4 was we went to every city department head and a bunch of like the Community Action Agency and United Way and people who would kind of know what the presenting issues were for in particular vulnerable populations. So we chose returning citizens, and then the organization we had planned to work with lost all their funding right before disappeared. We said, leaving, we're going to introduce you to the parole supervisors, or we stop this program. And I thought, oh, this will be interesting, right? So I'm going to go to the parole office and meet with 2 parole supervisors who I'm not imagining are going to be passionate about this work. And so we ended up saying to them, what would you most like to see, and how could we insert ourselves in a way that we could make you more effective, more efficient, which is the whole purpose of the Financial Empowerment Centers, environmental or social services more effective or more efficient. And they said, we would like for the people who are returning to this community for whom the state is paying their housing, where to go, right? And they can't stay in a shelter for whatever reason, usually the nature of the crime. So they said, we're paying their rent every month, and so they're supposed to stay 90 days, a year and a half. Can you help us with that? Because we can push them to save for the down payment, help them figure out, make sure they're in safe, affordable bank accounts. Bank account as soon as they put them in. And they said, well, we already had a bank. We said, okay, well, what we're going to do is we're going to bring our partners to the table. So anyway, after that first, house to the things that are not empowerment as well, but they see the link and how powerful this work was, their system more efficient.
Remind me what the question was.
Examples you've seen, across your region and across the firm, of where programs have delivered the kind of results that are meaningful and that sort of underscore.
Well, I think I can speak more so in general. I mean, considering we just launched yesterday, we just announced our commitment again to financial health, which is another $125 million over 5 years, focused on, one, expanding access to financial technology, those organizations, nonprofits that are using technology to help improve access to affordable programs, as well as on the coaching side. Definitely believe that the one-on-one coaching, counseling is something that has been proven to be able to assist folks with just ongoing services, whether it's building their credit, learning, addressing savings, or just-in-time services that are needed, that, having a program that provides that coaching, which is a couple steps away from financial literacy. It's that more one-on-one ongoing, which is what we believe has actually had really positive returns in terms of in working in communities. And so I just wanted to just kind of focus on those just two areas in general is where we're seeing the most success so far. And I would say over the last 5 years, going back to using the data, we've had over 250 partners that we've worked with across the globe. And so that whole point of data, it's like you get the information, you're understanding what your nonprofits are working with, what your local government's working with, and then we take that and we test, we go forward and we go a different way or try to enhance that. So it's that constant, how do you use the data to refine what it is that you're delivering and what you're working on. But there's hundreds of examples across in terms, especially with our nonprofits and especially with the bank on programs, being able to provide those services and just using tools that may be already available to enhance the services that they're offering. Mm-hmm.
I also just want to give a couple examples, a couple other examples of what we're seeing across our partners. The one-on-one counseling approach, the Financial Empowerment Center model. We're funding an initiative that's moving toward 50 cities. We're going to have another RFP coming out soon. If you're interested in this idea of what you're hearing is this idea of one-on-one financial counseling as a new public service, professional financial counseling as a public service. And I think what you're hearing about the magic of this service is not just that one can have that kind of program and do it at scale, but this is another unique government value add. Government has the ability to deploy and integrate that counseling into other public services that, as we were discussing before, are suffering from the financial instability of their clientele. When Amber says, I use this number all the time, when Amber says that people are moving out of supportive housing in the prisoner reentry context 28 days faster when they get this counseling than when they don't, you are talking about a complete win from a government perspective. The cost of a counselor doesn't come close to the cost of supportive housing. And so all of a sudden, this new, innovative, smart approach to dealing with the financial instability of your residents is saving you huge amounts of money. And, by the way, just to be human for a second, really advancing people's lives faster. And this is also, I think, key to the sustainability of these efforts, because while we're delighted to be able to make multi-year grants to support these programs at the CFE Fund and through other funders like Chase as well, those grants aren't designed to last forever. They are designed to plant seeds. And when government can create these extra stakeholders, when now suddenly the corrections and parole people are all about championing this kind of work and accessing public funding streams that are now being even more efficiently spent or saved as a result of this work, now suddenly this is the kind of work, this is the kind of innovation that gets embedded in just this is now the way government does X or Y. And that's important, of course, for scale. It's also important, let's be honest, for political sustainability, because new mayors come along and you don't want to see your innovation kind of crash on the shoals of politics. Let me give one more example here that I think has a lot of sort of innate curb appeal, and that's a program that we fund in about 16 cities called Summer Jobs Connect. Summer Jobs Connect comes up with this very basic idea, which is, remember, one of our streams in this field is banking access. Well, don't forget, government is often touching the unbanked or the previously banked but now unbanked population, and they're touching them not just programmatically, but they're often touching them with money. So what the idea of Summer Jobs Connect is, let's leverage this moment when young adults are getting, in many cases, their first job and their first paycheck, and let's not give them a check. Let's insist that banking access, direct deposit, is part of the program. This is basically how you have to get paid. We can talk about behavioral economics all day. Some cities are allowed to literally make it mandatory. Some have to have a back door, et cetera. But the very idea in the Summer Jobs Connect program that we're funding is let's just rejigger the payment system. Let's just access, we have a national certification of what a safe account is. And let's just say to these young adults, as they're signing up for a program that there are wait lists a mile long to get into, this is how you get paid. And by the way, you want to talk about financial literacy. If you really want to teach somebody how to operate in a bank account, then why don't you do it at a moment when they need a bank account and they're going to use a bank account or a credit union account. So it's really this idea in Summer Jobs Connect is leverage the money moment, leverage the infrastructure of payments so that now you are opening up accounts for those who aren't banked. You are direct depositing. You are providing information about how to use a bank account, how to directly deposit, how to save money, how to think about budgeting at a moment that actually makes sense. And you're doing it through the leverage of this city program that you're already running where you're pushing out money to people that you want to be serving. So I think Summer Jobs Connect is another really good example that's been successful and I think is replicating very quickly. We're going to go to questions in a minute. I just want to ask two more quick questions. I know that for many of you, this idea of municipal financial empowerment is new. Some of you may have heard a little bit about it. Amber, I wanted to ask you, what are some myths around this work? What are commonly held misconceptions? And you only have 20 minutes.
I love that you trust me to answer this question in public.
Yeah.
Because I have opinions. I have opinions about this. So the first thing is, you heard Jonathan talking about this whole concept of financial literacy. And if nothing else sticks with you today, just don't say that anymore. Just please don't say that anymore. Because it implies that the folks we serve are illiterate. And they are not. And so the biggest myth for me, especially the myth that I have to talk about when I'm in, say, a Rotary meeting or sitting with my local community foundation, is that there's this idea that all of us are economic robots and we will all act in our own economic best interest, right? The closest people to acting like economic robots are the very low income. I know, I have been them. And what happens is there is no room for an error. And when there is no room for an error, you know where every penny goes. You also know when you're spending money you can't afford to spend, but it's a decision. You know what's going to happen. So the more comfortable we get, the more we're able to make economic mistakes. You and I bounce a check, odds are we're going to be fine. One of our clients with $16,000 a year in average income bounces a check and it's going to screw them up for at least this whole pay period and probably for weeks on end. And it's a big deal. So the reason I bring that to your attention is the people acting most like economic robots are the very poor, meaning they are not illiterate. They are much more savvy than we are, and they can teach us a whole bunch of things. What they don't have is a set of hidden rules that the middle class get at the dinner table that the very low income generationally do not. And the hidden rules are things like you can renegotiate your interest rate after you've been paying on time for a while. You can change your payment date if all of your bills are falling on the same check. You know, there are lots of things like this that and this is what we call them in our Financial Empowerment Center is the hidden rules. And we are teaching the hidden rules and the secret resources for the people who that's what they need to get that leg up, is they need to know, okay, but you can go to this food bank while you're taking care of this. And so that is a huge part of it.
Can I just jump in 1 second?
Yes.
I think this is so important. You know, the analogy that always comes to mind for me is, you know, when somebody gets sick, they don't need a website. They don't need a doctor's manual. They need a doctor, for God's sakes. And I think that the same is true when we're talking about financial literacy, or financial stability. When people are actually in trouble with their finances, they don't need to learn something. They actually need help. And I think that that this myth that Amber's pointing out is really a fork in the road between government no longer saying you're it's great. But the other side, which is you need help, and we're going to get you services and programs and policies that are going to address the realities of very complicated finances, which are a growing problem.
And I don't want to hog the mic, but just a couple more pieces on that is that as cities, one of the ways we talk about getting started is this sort of low-hanging fruit idea. Well, we'll do lunch and learns, or we'll do banking access workshops, and the low-hanging fruit is not necessarily the impactful action that we can take, right? So thinking about this as a financial inclusion system or a financial capability system rather than a series of programs is super important. The other thing I wanted to talk about in myths is it very much related to that, which is butts in seats is not an outcome. This is something I make my staff repeat back to me. Butts in seats is not an outcome. So we can have a workshop and 50 people come, but if you don't give them an opportunity to practice what they learned in there, that they probably knew before the workshop, quite frankly. And if you don't give them an opportunity to practice, especially with someone who can mentor them through the process, they will have forgotten it by next week, and your 50 butts in seats will mean nothing, and all you did was waste a couple hours of staff time. And so I don't mean to sound cynical, but this is the world that I live in on a day-to-day is, well, why don't we just do some workshops? No. So, and then my final myth that I wanted to throw out is that there is a myth that as city government, we're so well loved, out there in the community sometimes, and there's a myth that we are going to doing well. What we are doing, you have to communicate that. You have to be like really upfront about that. I'm here to offer you some resources to prove we don't want in the program.
Yeah, this was very much our experience in New York when we decided to walk down this path of creating a one-on-one financial counseling as a free public service at a professional level, and we were talking to heads of long-standing, powerful community organizations. It had to be a deliberate conversation to be able to say, well, how much one-on-one professional financial counseling are you providing? And shockingly, at the moment, for me at least, the answer was almost none. That's not what nonprofits are resourced to be able to do, and if they are, those resources dry up fast. Literally, we found one organization, this is in New York City, one organization that had any version of one-on-one professional financial counseling every other Friday afternoon. So our ability to step in and not just say, hey, there's a gap, we think it's important, we're gonna fill it, but this is, I think, key to what Amber was saying, we're gonna fill it by procuring you to be able to provide these services, but now on government contracts is completely a win-win equation that was not what they thought walking in the door. I think that's important. Shakira, one last question for you, and this is always my favorite question in these conversations. What has surprised you in this field or in this kind of work? What was not what you expected, for good or for bad or both?
All right. I guess with that question, I come from the nonprofit, and so still relatively new to my role. But what I can understand in terms of just our ability to, in terms of how our approach, in terms of focusing, working with cities and moving forward this whole model of impact, I think perhaps one of the biggest surprises to the firm was just how much faster solutions were coming to the table once the collaboration was in place. And I mean, I think, people talk about, you mentioned philanthropic, or us as a philanthropist. The work that we do, I mean, we really try to leverage both the business side and our corporate responsibility team. We don't see them as separate. So you'll see that in the work that, we're doing, everything from how we make investments, how we're using the data, how we open up branches. So, the commitment to ensure that 30% of our branches are in low to moderate income communities. The feedback we launched, we had that, the liquid prepaid card. We heard from the community that there were some, it's a great program, it's a great card in terms of an entry point, but we also made, went a step further and then launched the secure card, the secure account, which is a low fee, checklist, non-overdraft account, basically learning and hearing from our community members. You know, you think about just going back to the liquid card, that was in place and it was great. But what folks said was, yeah, but it has its limitations. If I have this prepaid card, I can't use it, you know, for ride sharing. It has these other limitations. So I think, you know, just the whole process, I don't know if it's more so of surprise, but it's more so just how much more learning that we're getting from the process and the ability to make changes much faster with everyone at the table.
I also think that what you're hearing from Shakira is a real dynamic synergy between the philanthropic side of the house and the product side of the house. And I think that that has, you know, Chase has been one of many real heroes on that. And I think that all of us who have interacted with the community, the heroes in the community investment side of philanthropic organizations, you know, have always strived for that kind of synergy. I'm going to do a brief commercial and then we're going to do questions and answers. People sometimes hear about this work and they think that's great, and then they don't know where to start. As a result, we have started a program at the CFE Fund called, very creatively, City Start. There you may see a brochure. And City Start is actually a very deliberate process that we've developed over the last several years on translating initial political interest into community engagement and a very specific blueprint. So we actually have an open RFP right now for our next cohort of City Start cities. So if this is something that appeals to you, please let me, please apply, join. You know, we have a few slots and we would love to have you. And we can help bring in. And Katie, raise your hand. Katie's got flyers. And I think that RFP is open until May 22nd, so you still have a little bit of time. But again, allowing us to translate this kind of experience and navigate the political waters that go from, yeah, that sounds interesting, I've got other things to do, into let's actually come up with a plan. Okay, we have...
And I'll just say that applications are due May 22nd, but if you're really excited about this and you want to apply, if you don't think you can get it in time, email us, mention you're here, and we can probably work an extended deadline.
A special ELGL deal, right? We also, by the way, we also have scroll pens. I'm just saying. Okay, so we've got some time for questions. Anybody? Yeah.
So I guess a major question I have is what role or what partnerships have you developed with healthcare nonprofits or nonprofits that are doing healthcare work? Because talk about an American norm, healthcare crises is that financial, that, you know, most people are one healthcare crisis away from bankruptcy. Citibank Harvard said 44,000 Americans die every year because they don't access healthcare. So
yeah.
I guess when we're talking about financial empowerment, what role is government in philanthropy having with our healthcare providers to make sure our people are financially empowered but also healthy and safe? Do you want to?
Yeah, I'll just say real quickly, Amber as well, this is actually, I think, one of the cutting edge integration opportunities that we've been thinking about as well at the fund. I think the ability to show that financial counseling boosts health outcomes is a critical challenge. Are people taking their medications more reliably? Are they showing up for their follow-up visits, that sort of thing? I think it's really important. And I think what I would say is that having the infrastructure of high-quality programs like Amber's, having the ability to have the city deploy professional financial counselors by the city into some of those health partnerships, I think is critical, and finding the partners to be able to do that, I think it's a really important topic. Have you all played with this at all?
Yeah.
Yeah.
So one of the things, again, I will reiterate, think of everything in a system as you begin this work, right? So for those of you who haven't even begun to look at this work and you want to, think of everything as a system, and that is part of this important system. I will tell you, we thought medical debt would be the #1 thing for our clientele, and it's actually way under student loan debt. So just FYI, it was like student loan debt, not very nice auto loans, and then medical debt. But what we did to address this, and keep in mind we're very local, we're a city of 100,000. The nonprofit that we are partnered with to deliver our financial counseling is in a community center that houses a full service medical clinic. And what we do is warm handoffs between, but also that means anyone who comes for financial counseling that didn't know there was a medical clinic there has to pass the clinic to get to the financial counseling appointment. And so we push a lot. That's right. Hey, over here. And so that's been really impactful. Now I know not every city has a free medical clinic that's full service. In this in this community center, that can be your primary care physician, that center, which is amazing, and that is not something I've seen in other cities I've lived in. So there's that piece, and then there's also, in that same nonprofit that we are contracted with, they have a prescription assistance program that negotiates with, I did not know this until they schooled me on it, but the pharmaceutical companies have foundations, and they work with those foundations to get reduced rates. Totally funny stories about that later if anyone wants to talk on offline about it, but yeah.
Just to add something just really quick to that question, I think just one of the recent Advancing Cities winners, West Side United, actually had a health component in it, and so they were going to your point about systems, taking the systems approach. That particular group, the West Side United, so they were taking the hiring, procurement, and the investment power of the local healthcare system, and using that they developed a strategy to improve health outcomes by also addressing like jobs and access. So it's looking at the bigger picture. We talk about social determinants of health. Well, we know that that's one of the the biggest challenges is being able to have access, the job. So what can a major healthcare system within your community, what role can they play as anchor institutions? And so we actually, interestingly enough, in Advancing Cities had two efforts that included a health component to the work. So thinking largely systems-based.
Great. I think we've got time for one or two more questions. In the back, yes.
Hi. So as you guys were talking about how people who are financially struggling right now or have lower incomes, they're more savvy than probably most of us because they had to navigate this complex system. It's not about they not knowing how to use their money. It's about these systemic barriers that we put in place, right? Yeah. So what I want to know is how or when can we start talking about direct financial assistance for people who are in these needs? Because it's not that they're not working their asses off.
Yeah.
Mm-hmm.
I think there's no question, that getting direct assistance is a key part of the equation. That exists and has existed for a long time at varying levels of success. I think on the innovative side of this equation, there are cities, in fact, I think the chief of staff from Stockton was here. There are cities or Anchorage, sorry, that are experimenting with universal basic income experiments as well to see. That's tough to navigate politically, but a fascinating way of saying if we're just giving people this little bit of extra money to keep them on the other side of stable, will that deliver measurable results? There's a whataboutism to this work, like what about housing, what about better paying jobs, that you can get lost in. Sorry, yeah.
It's just that I'm come from the IT team in the city of Austin, and we're working with displacement, and this is one of the things that we're trying to explore. That it's not about housing, or it's not about building more or making it more affordable. It's about actually putting money on people's pockets. So
yeah, go ahead.
I don't know if you ladies have any thoughts on that.
So I know the session we've been talking about financial empowerment and financial health, with JP Morgan Chase. So our model of impact really also focuses on three other pillars. So in addition to financial health, we're also talking about focusing on jobs and skills in terms of ensuring that folks have access to those or pathways to middle skill job opportunities or higher paying job opportunities. We've talked about that being the other side of the equation. We also focus on small business expansion. That's the other thing. Most of the communities, small businesses are a tremendous source of jobs and income. So if we can make those jobs stronger, jobs held by women, people of color, then we can start to also continuously address the increased need for income. And then the third part, the other pillar that we focus on is neighborhood revitalization. So those four, in addition to financial health, is what we see as our, what we call a model of impact for driving inclusive economic growth. So it's not just the coaching piece. There are definitely the other parts that we equally look at as well in terms of how we make philanthropic investments and leverage our resources.
Please join me in thanking our panel.
It's really nice to meet you.
And if you've got more questions, come grab them.
Are you leaving? Are you leaving your flight? I leave. So you got lots of tea.
Oh,
like
okay.
Just tea.
Oh, no,
I never panty attention.
I know. That's very nice.
No,
that's very nice.
You say, how are you?
I always assume you're just so important you don't have an hour that you can be offline. That's what I think.
Thank you. That was yeah. It's sort of maddening.
Yeah.
It's one of those things.
Policy work that we're supporting for nonprofits and the policy work that they're doing, especially on that. So, yeah, I mean, I live in Miami where it's a low tax state, lower tax state. I mean, there's no state income tax. There's no, so yeah, but that's definitely.
It's becoming a thing.
Yeah.
And it's good. I feel like it's going to be more.
Okay. To reduce, and that tax is income tax or just all types of taxes, property tax.
In Atlanta, so the new, we are releasing open stadium.
Yeah.
Yes.
Yes.
So they have
The West End. Yeah, I'm familiar. It's also in my region, so I know about that group that's doing work, enterprise, and the whole, the policy work with the house ATL.
Yes.
Yes.
So we hired the same firm in Atlanta to do the studio.
Oh, okay.
And I think they'll be able to do some good. And, and the city is also putting some money towards helping folks too.
That sounds like a nice magic, right?
That's our main source of revenue. But anywho, I wanted to see if we can connect.
Yeah, do you have a card? I mean, I have a card too.
Since then, and they're saying, we're not against what you're saying about stonewalling, but you've got to front that up against some
About, what Jake and Morgan Chase are doing in the Institute.
and that's the piece that, we've been doing, it's the national stuff, and there's even some.
And Charlotte is one of the areas that we are expanding our retail presence. So right now, no, not as yet, but we are. We have a presence, but with our retail expansion to Charlotte, that we'll be doing a little bit more. So, trying to connect and make the connections and understand what are the most pressing needs, what are the opportunities, and just really understand even more. So that's my role. Obviously, nonprofit engagement is to really kind of get a good picture. So I would love to have a real conversation.
Just in case.
So I'm with
973.
Okay.
and I'm actually wearing two hats.
Okay.
That is it. Cool.
All right.
So when you're done, whenever you're done,
Okay.
just text me.
All right. Well, sounds good. All right. I'll see you in a bit.
Okay.
And foundations to help them get their issues heard.
Okay.
So I host public feedback meetings
Okay.
and stakeholder meetings and survey work.
Okay.
And so I can't think of exactly how we could work together.
But I think right now it's more at least just to have a conversation, research it, just so the Institute's reports are all on our website, so there's that, but would love to have a follow-up conversation, but just so you know, it is publicly, that's one of the things we wanted to not only do the insights, but also make it available, so that our partners could have access to it as well.
Well, I'm gonna look into it and I'll send you.
Yeah, it's all under our corporate responsibility arm.
Thank you so much.
Thank you.
That was really, it was a fun conversation.
Nice meeting you. Yeah, same here.
Christina Edwards in the city of Charlotte.
Oh, sorry.
Well, with Edward County, but.
Got it.
Thanks for being here.